Hello everyone, my name is Rivia Tang. Today I would like to introduce you a dental procedure called root canal. So what is a root canal? A root canal is a dental procedure that treats an infected or damaged tooth by removing the infected pulp and replacing it with a filling. What normally causes a tooth to need a root canal? So first would be a tooth decay. If a cavity reaches the pulp, a root canal may be necessary instead of a filling. A crack or damaged tooth. A bacteria from plaque can infect the pulp of the cracked tooth or damaged tooth. Repeated dental procedures. Repeated dental procedure on a tooth can lead to a root canal. Or a faulty crown. A faulty crown can lead to a root canal as well. And the tooth sensitivity. If you experience persistent pain when eating or drinking hot or cold food and drink, a root canal may be recommended. A loose tooth. A loose or wiggly tooth may indicate a root canal is needed. And the trauma. If a permanent tooth is dislodged, a root canal is usually needed. So how do you know if a tooth needs a root canal? First would be the pain. Normally people will come into the office and let us know that they're experiencing some pain. So severe pain while chewing or biting, or pain that doesn't go away. Second one would be sensitivity. Lingering sensitivity to hot or cold even after the sensation has been removed. Third, discolorating. Darkening or discoloration of the tooth. The fourth would be swollen gums, swollen jaw, or additional swelling around your face or neck. Other symptoms would be a chipped or cracked tooth, a loose tooth, pimple on the gums, or an abscess or lesion formed on the gum area surrounding the tooth. A dentist can determine if a tooth needs a root canal using a variety of methods, including x-rays, thermal and electric testing, tapping on the tooth, or selective anesthesia. Before the dentist performs a root canal, we normally would do the diagnosis. It's called periapical diagnosis. It's normally testing with the percussion, like you tap on the tooth, and it indicates if you have pain or no pain, and it will tell you which of the four of the periapical diagnosis is. Then the second one would be the pulpal diagnosis. It's the thermal test. Normally we would put endo ice on Q-tip and put it on the tooth, and we would ask the patient to describe the pain level and see if they feel any severe pain, and to indicate the pulpal diagnosis. And then lastly, before performing the root canal procedure, with the diagnosis, the dentist will numb the area. It's the anesthesia. A local anesthetic is administered to numb the tooth and the surrounding area. Then the dentist will place a rubber dam, surrounds the tooth to keep it dry and saliva free. And third would be the access opening. The dentist drills a small hole through the top of the tooth to access the pulp chamber and root canal. The fifth would be pulp removal. The inflamed pulp is removed using a small instrument. The sixth step would be cleaning and disinfecting. The inside of the tooth is cleaned and disinfected with an antiseptic and antibacterial solution. The seventh step will be filling and sealing. The root canal is filled with the biocompatible material and sealed with the dental cement. And the last step would be temporary filling. A temporary filling is placed over the opening. Then lastly, we normally do the crown in separate procedure due to the length of the procedure. A dental crown is placed over the tooth to restore its appearances and protect it from further damage. Where the filling material is not strong enough to hold the tooth up, so eventually every root canal tooth will require a crown.